Alright, so today is, let me fix this a little bit here. Today is post-op recovery day 1 from my cervical posterior foraminotomy from the spondylolisthesis of the C7-T1. Just want to give a little bit of an update, tell you how I have been doing. So some things that I left out yesterday. When I went back to the operating room, one thing that I said when I was laying there on the bed before they put me over onto the operating table, I was laying there and everyone was just kind of chit-chatting amongst themselves, and I started seeing everything kind of go wonky, and I said, hey, did someone slip me some of that funny stuff? And got a few laughs out of that, and someone said, yep, we did, and they said good night. And yeah, after that, lights were out. Not sure why, but I feel like my eyelids were taped shut. That doesn't make any sense, because for the posterior surgery, obviously I would have been laying on my belly, but my eyes feel like there's tape residue. I haven't spoke to the surgeon personally, but when I do, I'll ask him why I would have that. So some things that I had for this operation is, this is kind of gross, but it's a drain. I have the drain in the back right beside the surgery site. It's obviously draining the blood. They check it, I think, every 8 hours, and each time the theory is for it to be putting out a little bit less, and then as it's putting out less and less, then at some point they will be able to remove it. I forget what they said it's for. I guess like just as they were doing the surgery, the surgeon decided it was needed, I think, in order to make sure that, like, I don't know if it was to make sure a blood clot doesn't form or infection doesn't happen, just with the amount of fluid that could build up. But yeah, so I have that, and because I have that, they also need to keep me at a 30% incline. So that's how I have been sleeping and sitting since the surgery. Another surprise, I guess, that I had was a catheter. At first, I was absolutely disgusted by it. Hang on. Someone coming in? No. Okay, so I was not happy, I guess, by it, because the thought of it just totally grossed me out. But then I realized, wait a minute, I don't have to get up and go to the bathroom at all. I was happy about that just because of the fact that I was in severe pain, and trying to get out of bed obviously sucks when your shoulder blade area hurts, and it's not the easiest to try to push out of bed. You have to log roll and all that junk. So I actually wanted to keep it in for as long as I could. They did take that out this morning. The way that they took it out was I had to just put my legs out straight, and she said that I needed to just take a deep breath in, and then she said she was going to deflate the balloon, and then when I blew out, she just yanked it out. It sounds gross, but honestly, it really wasn't that big of a deal. It took less than a second, and the sensation just was sort of like I felt like I was going to the bathroom, but obviously I didn't pee on her. Not a big deal. And then after that, I just went to the bathroom as normal, and I am feeling better than yesterday with the medications. I am on a good routine, switching back and forth between Dilaudid through the IV and 2 Percocets. I do those every 2 hours. So I'll do Dilaudid, then 2 hours later I will do Percocets. And that's really helping keep the pain a little bit more managed than how I was yesterday when I first came out of recovery. Yesterday, I think I mentioned that I did physical therapy and occupational therapy, and it was pretty difficult. Today was a lot easier. I did a pretty long walk with the therapist, and I was super duper slow. Kind of walked like this, holding my arms, just because if I kept my arms down, it would basically feel like the weight of the world was on my shoulders, and all of that. So I just kept myself propped up and walked that way, and it felt amazing to just be out of bed. I did that just once today, maybe around 2, and she grabbed me a coffee on the way back. So again, it was just nice being out of bed. And after that, another thing pointing out, let's see if I can get this beautiful, look at these ugly things, aren't those something? But this is my compression sock, and I have these on both of my calves, and that's just to help prevent any blood clots. I've had those on since I first got here yesterday. They actually feel quite amazing. I also will point out I have this lovely pillow that I brought from home. If you are also having any type of neck surgery like I did, I honestly strongly recommend you bringing your own pillow or any type of super duper soft pillow. When I got back to this room after my surgery, I was trying to use the pillows that they have here. They felt like rocks. I felt like I was laying on a piece of concrete. Oh my God, it sucked. I kept trying to readjust those pillows and nothing was comfortable. When my daughter brought me back this pillow from my place, man, it was heavenly. I was finally satisfied. I was finally comfortable in comparison. I mentioned the painkillers, doing those every 2 hours. Staying on top of them has been extremely helpful. And the nurses have been very good as far as coming in every 2 hours and giving them to me just to make sure that I don't fall behind. Let's see, I was just checking to see what else I wanted to talk about. Another thing that I did yesterday, I don't think I talked about in the other video, was I really did not feel well at all yesterday, understandably so. So I limited visitors to my family only. And today it's pretty much been the same. I've had a few extra people come today, but that was really important to me. I needed to rest, and my friends have understood that. So not overdoing it has definitely been the key. I need my rest, and when I am home and feeling up to it, then I will have more visitors as I feel like it. As far as getting out of here at this point, I am still aiming for tomorrow. Looking forward to it. And let's see. I think that's about it. Definitely, hopefully you can tell by looking at me, I'm definitely feeling a lot better than yesterday. Oh, I was able to see the surgery site. The one of the nurses, she took off the gauze around the surgery site, and she took a picture of it for me. I want to say it's about yay big, however big yay is. And yeah, it sounded like that too. It turns out there are 6 screws. I thought there was 2, but there's 6 screws and 2 rods. That's something that my Mom was telling me about today. So, yeah, that's it. I'll try to get some pictures attached at some point once I'm home and have the ability to edit. So, alright, that's all. Let me try and turn this off this way maybe so I don't hurt myself again. Bye. Doesn't work, does it? Alright. Shoot. Come here, you. Ooh.